Hey, what's up? This is Corey Dion Lewis, founder of Healthy Project Media and the host of the Healthy Project podcast. Join me as I speak with change makers who are doing the work and sharing their stories, insights, and innovations to close gaps in healthcare for everyone. Hello, everybody. Thank you for listening to the Healthy Project podcast. I am your host, Corey Dion Lewis, and I have a great guest with me today. No one not unfamiliar with the podcast. Actually, I don't know. It's been a while since you've been on the show, but you're a returning guest of the Healthy Project podcast. And we're going to be talking about some really cool and exciting news. I have the CEO of Lapsi Health. We're going to be talking about their new product, Keikku. Thank you so much for being here, man. I appreciate it.
Thank you so much. I'm honored to be called back to the podcast.
Yeah. So, well, first of all, congratulations on launching, and correct me if I'm wrong, the world's first FDA-cleared smart stethoscope with integrated AI scribe.
Yes.
What does this milestone mean to you and your team?
I mean, we launched the first generation of Keikku around last year, December, and we wanted first to just launch it in the market and see how that would work with our target audience, which are clinicians. And we saw, okay, this is getting traction. We had a bigger vision, of course, for the product, but we said this is getting traction, and now this is the time to unveil the rest of it. So the rest of it was, how do this device, which is basically a machine learning led device, converges into the world of generative AI and allows us to be able to use generative AI outside of a computer, outside of a phone, directly through a medical device. And for us, this is big because this is the first step of generative AI entering the world of medical devices. It has penetrated multiple other aspects. You have generative AI sunglasses from
Right.
Meta. You have generative AI translator pens and clips that can take your notes, but it has never entered the world of medical devices until now. We are honored to be the first one, privileged to be able to be the world's first, and it is a responsibility that we carry, to bring it with safety and trust for the clinician community.
Yeah, that's so dope, man. So, walk us through what makes Keikku unique. And you already kind of talked about, that as well, but walk me through what makes that unique and how does it work during like a typical patient encounter?
Yes. So Keikku, which I have it right here with me, basically has two sensors. It has, on one side, it is a stethoscope. On the other side, it has a microphone system that listens to ambient. So you can use Keikku whether it is clipped to your waist, whether it is on your desk, or even in your hand. Basically, Keikku uses gestures to be able to be manipulated, and you can activate transcription just with a gesture. And when you activate transcription, it starts to basically listen to your encounter. It will grab all that information and summarize it, structurize it into a SOAP node, and deploy it on our web application. And then you can go ahead, if we have the connectivity with your EHR, it will go directly to the EHR. If not, then you can always grab that information, put it into the EHR. On the other side, you have the stethoscope, which is fantastic stethoscope that delivers you an incredible experience of audio, clear sound. Many doctors have already vetted it. Pulmonologists, cardiologists, internal medicine doctors, pediatricians. We got so much feedback of how clear and amazing the sound is, how well defined it is, and how easy it is to really understand what you're listening to by a clinician. So we have this incredible experience that is also matched by intelligence, so artificial intelligence analytics. And that is done with the other sensor. So you just grab it, you put it on the patient's chest or back, you obtain that information. It's analyzed by AI. It is deployed as part of the data that goes into your SOAP node in natural language and into the EHR. So everything converges together, building just one experience that allows you to be able to use both types of AI models.
And I can only assume, Jonathan, that yes, it's great that you can get that information, but the I can only assume as a provider the amount of time you are saving.
Yes.
Can you talk about that? Like, was that uh, any of your feedback? Was that something that you heard or something that you assumed, like as a provider yourself, someone that practiced medicine, like, hey, this is a time saver as well?
It is definitely a time saver. I think we just had a post today on LinkedIn from one of our doctors, Harpreet Sui, that she just posted. It's been 4 days with Keikku, and it has already revolutionized my practice on LinkedIn. It's amazing because it fills us with pride, right? We're doing something amazing for the community, and of course, it falls directly into patients. This benefit is even, I would say, it's even bigger for patients because they can really look at their doctors directly in the eye, tell them what they are feeling. They know by you're gonna see a Keikku, you know your doctor is accurate, you know your doctor is efficient, and you know your doctor has the time to really pay attention to you 100%. So it definitely saves time. We calculate the ROI on 6 hours a week approximately of documentation time, and then it definitely saves you also time in terms of clinical writing. You will be able to deploy the results of the AI on the auscultation directly in natural language into your SOAP note. You don't have to dictate it, and on top of that, it gives you more accuracy. The AI will analyze that auscultation, will be able to tell you whether you're hearing a murmur, whether the murmur is located at systole or diastole, whether you have a respiratory pathologic sounds. The analytics are coming in escalated way. So in a evolutionary way, we're launching the first analytic available in the App Store by the end of the year, and then we'll have the next battery of analysis of respiratory sounds in Q1 or Q2 in 2026, and it will give doctors this freedom to be able to know: one, I am very accurate. I don't have to sacrifice accuracy for efficiency, and I don't have to sacrifice efficiency for accuracy. I can have both, and that's what Keikku gives.
Right, right. And we can't, for me, I feel like we can't have this conversation about, health tech or healthcare and AI without talking about cybersecurity in healthcare, which is, critical.
Yes.
How does Keikku ensure patient data remains safe and secure? What does that look like?
Well, first of all, Keikku is a complete HIPAA compliant system. Also, it's GDPR compliant, which for people that are really into cybersecurity and compliance, they know that GDPR is way more strict than HIPAA in terms of compliance. So if we are both, we are really cyber secure and compliant and private. On top of that, we are a class medical device, right? So the standards that FDA or the European Commission set on companies that have an ISO for medical device manufacturer and that actually have a certified medical device are way higher than the standards of, software companies without certification. Because of that, we are ensuring that our services remain in cloud on geographical areas, that everything is private and anonymized, that there's no data leakage, that we're doing testing on cybersecurity regularly. We are complying with all the ISO and other regulations on cybersecurity, and we're following a strict automation of our compliance with companies to be able to ensure that our company is always to the standard of cybersecurity and privacy.
Right. So if a patient's in the office and they see this new device and they don't have to feel, hey, where is that going in the cloud? Someone's going to, take my identity, whatever somebody may think.
Right.
There's some sense of security that, this
Yes.
my information is staying with my provider and those people who are a part of my care team or whatever, and it's not going anywhere else.
Exactly. It is 100% compliant and it's 100% cyber secure and private.
Perfect. Perfect, man. And you know, one of the questions that came to me as thinking about our conversation today was, in a way, physician burnout and that crisis around physician burnout. Um, as you can only imagine, it is at an all-time high as far as, and I'll have some of those research and links in the description of this episode so people can follow along. But with the administrative burden being a major factor, how do you feel, or how does Keikku address this crisis, or is that something you've thought about?
100%. We realized that physician burnout is one of the biggest, let's say, epidemics happening among populations of healthcare providers and professionals. We, myself as a clinician, I have been always very embedded in the whole world of trying to fight, clinician and physician burnout. What Keikku wants to do is address this by giving them freedom, administrative, unburdening the administration, allowing them to be able to have more control on the tools that they use, and the most important part is providing them time back in multiple ways. So currently, we're doing it through scribing and generative AI reasoning and accuracy on diagnostics. And in the future, we will add more layers of AI models so that Keikku becomes that weapon against burden and burnout for them, that allows their work to be seamless and unfrictioned.
Yeah, man. You've been a healthcare entrepreneur for a very, very long time, and you've been solving problems within this space. What was it about this product that got you excited? Like, what was the problem that you saw, and you were like, "Hey, this is it." What was that?
I'll tell you. So I've been thinking about medical devices and electronics for a long time, and I've been working with multiple companies. I was the chief medical officer of a company that built wearables as wristbands for medical usage in hospital, and then sleep apnea devices, um, cardiac ECG, AI. I've been in the whole spectrum, and one thing that I realized is that I've been working in multiple companies that had fragmented point solutions. And this reminded me, because I am a fan a little bit of Steve Jobs and the great electronics professionals of our time. And one thing that kept coming to me is, I always loved how the iPhone was brought into the market. Well, before the iPhone, before the smartphone, we had all the technologies that the iPhone brought. They didn't disrupt any technology. We had a digital camera, we had MP3 players, we had phones, we had that technology. What they disrupted was, or the way they disrupted was bringing all those technologies together, right? Eliminating fragmentation and creating this convergence of technologies that allowed them to become the standard. And I thought to myself, nobody has done that in healthcare. You know, just we have these scribe technologies, and we have these generative AI reasoning tools, and we have the stethoscopes, we have the AI tools, but they're all spot solutions, disintegrated
Right.
from each other. What if we bring something that converges them all? And we create a structure that allows these technology convergence to become one singular product, one point of entry, one interface. And that is what got me super excited, because nobody has done it. And I thought maybe we're the first ones to do something like this.
No, that's amazing. And to kind of go along with that Steve Jobs type of energy, is there plans for a next generation? Like, what does the next generation of Keikku look like?
We have, well, you're putting me in the spot here. We have, we have plans to introduce new sensors, because the whole point of Keikku now is to expand beyond sound. So sound is our point of entry, and we will add more sensors that will, of course, be able to interface new models of AI to deliver new biomarkers. There is also an evolution, just as Apple has an evolution of their hardware and an evolution of their software, right? Usually, every time they bring a hardware evolution, at some point they bring an iOS evolution. We also have an evolution of Keikku AI, and that one is coming soon. And we're going to have some amazing analytics that I can't disclose currently, but that will basically enhance the clinical aspects of doctors being able to screen to their patients even faster than they've ever imagined.
Okay, no healthy project exclusives. I get it. I understand. I'll wait like everybody else has to wait. um,
Couple of months, only a couple of months.
there you go. Well, we've been here talking about Keikku, the first FDA cleared smart stethoscope with integrated AI scribe. But I want to kind of talk to more of our some of those impact entrepreneurs. Like I consider you an impact entrepreneur, health tech entrepreneur, and there are people who are listening, who are trying to make an impact in the world in some way. Sometimes some of it's not through technology, but as we move further into the future, public health and technology are coming together, um, which we should be. If you're talking to somebody who wants to create an impact through technology, what would be some advice you would give them?
I think um, impact creating impact with technology, of course, is difficult. Um, it's one of those places where you have to be very patient, and you have to maybe be very humble. If you're a clinician and you have an idea for impact and technology, I would say one thing is, and it happened to me as well, so it's a lesson that I learned. You have to be very humble and realize that all your years of a clinician, your specialty doesn't necessarily give you the technological, background to be able to really come with a product immediately. You're going to need to look for people to collaborate with you. You're going to have to realize that you don't know everything, but your mission and your vision, they will be the north for that team. So I would say be humble, look for a team that wants to help you to achieve that mission, and from that point onward is just perseverance and a lot of time.
No, I love that. I love that. Patients, especially trying to change healthcare, is that's a big lift. Yeah, I think
Yes.
patience is one of those. It sounds when you say it like you're expecting someone to give you this really big like thing to go toward. But when you say patience, it's like, wait, that's it? Like, but yeah, I mean, sometimes
Yeah.
it's patience.
It is time, it is hard work, and it is just basically a lot of patience. The thing is that in technologies that are related to healthcare, you have to be very safe. You have to build up trust. You have
Mhm.
to validate your claims. There are so many steps that are maybe in the current consumer electronics or software. You don't have those limitations. But in healthcare, those limitations are also guardrails, and they are placed for a reason, right? They are placed for the safety of our patients, which is always at the core of everything we do. So you have to be patient. You have to let the process to actually unravel to be able to develop the technology, validate it, and bring it to market. And then you have to have that vision and mission engraved in your team. They need to know what they are fighting for because they have to be patient too. We have a team that is very loyal to our company. Like our team is amazing. I am very lucky and to have the best co-founders, Diana Van Stein, which is the person that thought about this idea first, and I took that idea to execute it together with her. And then the team that built this technology, we have already a sizable team in the Netherlands and Finland, and now starting to build up a team in the United States. They all work for the mission and the vision. They have been patient for since 2022 to build up a technology. They could have been in a consumer company that brings to market a software product in 6 months, but they are here because they want to change the world, because they want to change healthcare, because they believe in the impact of you know healthy living. It's really important to us.
That's awesome. That's awesome. Hey, I want to thank you so much for being on the podcast with me today, man. This was we've been trying to make this happen for a very,
Yes.
very long time. I'm so happy it happened. For um, if there are listeners that want to learn more about Keikku or try it in their practice, where should they go?
They can go to keikku.health. Keikku is Keikku.health. And we have a lot of information in the website. We as a medical device manufacturer are pledged to give you absolutely every piece of information. We also have a really interesting AI chatbot that can respond to your questions. And if you can't find the questions that you have, then just reach to me directly. I am on Instagram, on LinkedIn, on Twitter, just now X. Um, Available in all the social media platforms, and it's easy to reach to me. I'm very responsive. I love to respond to clinician questions, even if you think, well, this question is very tiny. Just ask it, and we will be very happy to attend you.
Perfect, perfect. Well, and I will make sure I have all of that linked in the description of this episode on YouTube as well as the audio platforms. Again, thank you so much for being here, man. I really appreciate your time and talking to us more about your new Keikku, which is sounds amazing.
Thank
And
you,
again,
Corey.
everybody, thank you so much for listening to the Healthy Project podcast. I'll holler at you next time. Hey, thanks for joining us on the Healthy Project podcast. At Healthy Project Media, our mission is to connect with the next generation of health leaders and innovators. If you're interested in advertising with us or exploring collaboration opportunities, please reach out at hello@healthyprojectmedia.com. We look forward to growing this community together. Until next time, keep pushing the boundaries of health.